You're listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hi, this is Dr. Marzell. Today I'm talking about the brain, and I'm talking about what does physical exercise help your brain? And if it does, what type? And how much do you have to do? I found a very interesting article, a research article, which encompassed several different results of studies on a variety of exercise and brain function. This was published in the Sport Health Science Journal, and I'd like to just read you a little bit of it. The title of the journal article is a review article called Physical Exercise in the Prevention and Treatment of Alzheimer's Disease. So in this particular compilation of a variety of different studies, they are looking at, does exercise help you to maintain cognition? Does it help you to improve cognition? And so anyways, let me just read a few little nuggets of knowledge for you to chew on here. Alzheimer's disease is the most common dementia, and 90% of the cases of dementia in the elderly population have Alzheimer's disease. It is thought to be irreversible and have all kinds of behavioral loss and cognitive loss. In Alzheimer's disease, this is characterized by the loss of neuronal synapses or connections of one nerve to the other, accompanied by progressive cognitive neurodegeneration, or nerves, not functioning well, aging, broken kind of. The regions are associated with more complex brain functions such as hippocampus and neocortex. And these are the areas that are usually the main target areas for Alzheimer's disease. There's three bad things that happen when brain degeneration occurs causing this, and it's really not important that you know the specific names of these, but one of them is neurofibrillatory tangles. So in other words, like somebody put a net over your brain and it gets in the way of your nerve synapse and the messages. There's also some damaging protein like amyloid beta protein and tau protein. These can all interfere with brain function. Alzheimer's disease has an inflammatory problem with brain function. So getting settled from brain inflammation is very, very urgent in this. Now, several studies have been done looking at, does physical exercise help? Does it help with normal people? Does it help with people who already are having problems? It seems to be an inverse relationship between a physically active life and the risk of suffering cognitive decline. And this has been widely documented. Aerobic exercise training, most extensively used for evaluation of physical activity in protecting your brain. I want to read a few of other studies that have been done and reported in this particular journal summary. There is a positive impact of long-term exercise training by delaying the onset of physiologic memory loss, suggesting the effectiveness of exercise as a preventative strategy against age-related memory loss and neurodegeneration, which means nerves that are become just I don't know how to describe it. They are not healthy functioning nerves. They are deteriorating nerves. One study found in 1 year of using moderate intensity exercise, and this meant exactly 40 minutes of duration, 3 days a week. This increased the size of one of the areas in the brain known as the hippocampus. Now, the hippocampus is part of the limbic system, and this is involved in learning short-term memories turning into long-term. In other words, putting your short-term things that are going on into remembering them for a long period of time. But increasing the size and function, therefore, of the hippocampus, that's pretty cool. They found in this particular study that there was an increase in spatial memory also. The individuals in this study were healthy, older folks, not already struggling with Alzheimer's disease or something. Another study with exercise and the effects on the brain found that in 6 months of exercise, and this was defined as 60 minutes duration, 3 days a week, is sufficient to increase gray and white matter in the brain. So it actually helped brain grow into a better, bigger, more functional brain. That's pretty cool. 60 minutes, 3 days a week. Longer aerobic exercise training protocols of like 3 years duration with sedentary older women. This particular study was another one and showed improvements in reaction time, motor function, and cognitive processing speed, indicating that exercise is effective in reversing or at least slowing the age-related declines in motor performance and speed of cognitive processing. This might be very helpful if you're planning to go on a game show in the future. You want that speed of response right up there. Let me talk a little bit more about this. Now, resistance training is an entirely different thing. This is like weightlifting. This is weightlifting, actually. So some studies were done to see if weightlifting had anything to do with protecting your brain. One study showed resistance training had no effect on the working memory measurements. However, as they reviewed their study, they realized there were some positive effects on cognition. So that one was kind of like a teeter-totter. Good, bad, we're not quite sure. But there were other studies done about that particular type of exercise that were a little more conclusive. Components of both aerobic and resistance training of moderate intensity lasting for at least 45 minutes per session on as many days of the week as possible have been found to be beneficial to cognitive function in older, healthy adults. A meta-analysis on 16 different studies with more than 160,000 participants found a 45% reduction in the risk of developing Alzheimer's disease due to the practice of physical activity. Similar results were found when they looked at patients who were suffering from Alzheimer's disease already. Several studies have found improvements in executive function, memory, and cognitive tests as evidenced by even if they had mild cognitive decline already. So that showed up pretty good. Let me just quote a few more of these studies. They're pretty fascinating, I think. In individuals diagnosed with Alzheimer's disease, at the early stages of the disease, aerobic exercise alone or accompanied with cognitive stimulation induces improvements in some aspects of brain function. So it's certainly worth doing this. Few studies have been published on the effect of resistance training in people with mild cognitive decline or Alzheimer's disease. But there was one trial included 100 people between age 55 and 86 years of age with mild cognitive decline. In this study, it was shown 6 months of resistant exercise induced improvements in memory, attention, and executive functions. Moreover, these benefits persisted 12 months after the end of the intervention period. That's just absolutely astounding to me. There are, let me just conclude with one more study that I found very interesting. And it had such a cute name for its title. I just had to tell you about this one. The Finnish Geriatric Intervention Study to Prevent Cognitive Impairment and Disability, also known as FINGER, looked at the intervention of cognitive decline using diet, exercise, cognitive training, and vascular risk monitoring, which resulted in improvement or maintenance of cognitive functioning in at-risk elderly people from the general population. This was a 2-year study, finding that it was possible to reduce the risk of cognitive decline among that general elderly population. And the final thing I would love to read from this compilation, this was not just a study, it was a compilation of a whole bunch of studies, was the beneficial effects of physical activity go beyond skeletal muscle and involved adaptation of other organs. Exercise causes changes in the brain at a variety of levels: anatomical, cellular, and molecular levels, by inducing a cascade of cellular and molecular processes that promote different physiologic phenomena, including helping produce blood vessels to provide oxygen and nutrients to brain cells, the manufacture of new brain cells, helping brain cell 1 communicate with brain cell 2, and the stimulation of factors that enhance learning, memory, and the ability of the brain to react to different circumstances. In this, it also talks about how important it is for exercise to calm immune function and therefore settle inflammation, which is a destroyer of brains and other cells. They found in another study, particularly in elderly people, regular physical activity has a positive effect on the reduction of inflammatory markers. Now, you can get some of these done in a regular blood test. A very common one is C-reactive protein. Any doctor or practitioner can order this simple test. If it's high, it means you have a lot of inflammation in your body. You can also look at some of the specific cells that are involved in inflammation, like tumor necrosis factor alpha or something like that. But C-reactive protein is very simple, very easy, just requires a blood sample, and it reflects general inflammation. Now, maybe we should check everybody's level of inflammation, particularly those who are having chronic irritation, chronic gut problems, and sometimes chronic brain problems. I hope you enjoyed some of these little jewels of information from this very important article, bringing all kinds of new studies and their conclusions, but seems like it would be a really good idea to have some kind of exercise program going. I wanted to go into some particular activities that I think are especially related to brain function. And I tell my patients to do these to kind of help sharpen their brain up. One of them is dancing. Now, why is dancing so good for your brain? Well, it's good exercise for one. But if you're dancing with someone, let's say that you're the follow, usually a woman of the pair, you have to figure out what your partner wants you to do, where you need to go, do you remember the steps, and where does he want to go next? And he has to ask you to do something and then see how you're responding and where he's going. And he has to decide all the different things he wants you to do. And after he asks you to do that, then what is he going to do? So it really helps with brain function, and it's also kind of an aerobic activity. Also interesting for your brain, ping pong. And I guess you could say pickleball, tennis, or other activities where you have to, let's just take ping pong for instance. You have to discern where the ball is coming at, what angle it is, what speed it is, what angle you have to hold your paddle, how hard you have to hit the ball, and at what angle do you hit it. So all these things involve your brain, and it involves it quickly. So that's pretty cool. And the last thing I would like to bring up to enhance brain activity is that there is a website put together by a neurologist who specializes in brain studies. And it's called Brain HQ, or like Brain Headquarters.com. Now in this, he's devised a variety of little kind of games that you can play on your computer to help stimulate your brain, and he divides them into different areas that you might want to work on. Memory, or awareness, or things like that. And that can be, if you do this a little bit, your brain starts getting used to, oh, well, what's that? What's this? And it becomes more aware. So it's kind of cool. Anyways, I hope you derive some information and some encouragement about how great exercise is for your brain. And I will be talking in my next podcast about supplements and hormones and things like that and how they affect your brain. So stay tuned, and thanks for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.